It is my pleasure to welcome you here to the Long Beach Fire Department Station 1. My name is Julie Ruano. I am the Communications Specialist for the Guidance Center. It is an honor to be joined here by Patricia Costales, LCSW and CEO of the Guidance Center, and also Javier Espino, Fire Chief for the City of Long Beach, and Eric Garcia, Fire Chief for the City of Burbank, and President of the Los Angeles Area Fire Chiefs Association. The Guidance Center, along with our firefighter and paramedic partners, welcome you to our press conference to announce the launch of the award-winning First Response Mental Health Training videos in honor of National Mental Health Awareness Month. First responders increasingly play a critical role during emergencies that involve a mental health element. The First Response Mental Health Training is a new series of web-based training modules that provide first responders with essential orientation to readily identify the signs of mental illness in the field and to de-escalate these encounters safely and effectively. The First Response Mental Health Training video series was produced by combining the Guidance Center's 75 years of mental health and trauma expertise with the reputable knowledge base from the Los Angeles Area Fire Chiefs Association, the Los Angeles Area Regional Training Group, the Long Beach Fire Department, and their mental health evaluation teams. Formatted to be shown between calls, this series provides EMS professionals with a cost-effective, ongoing mental health training program without requiring departments to incur the typical expenses associated with one-day crisis intervention trainings. Funded by a grant from the Amundsen Foundation, the videos can be accessed on the Guidance Center's website today at no cost to any fire department across the country. At this point, I will turn it over to Patricia Costales, LCSW, and the CEO of the Guidance Center.
Thank you and welcome everybody. I am Tricia Costales. I'm the Chief Executive Officer of the Guidance Center. We are a Long Beach-based nonprofit children's mental health organization serving close to 3,500 children and families every year. You might reasonably ask what a children's mental health agency is doing, partnering with fire departments to produce training videos. I think that's a reasonable question. Our primary mission is, of course, to provide very effective mental health care to the children that we serve. Our secondary mission is to use our leadership role in the mental health community to help to erase the stigma around mental health and to partner with community organizations and governments to really improve the stigma around mental health and to create more trauma-informed communities for our children to grow up in. The story of these training videos really began several years ago with law enforcement. I was on a phone call with then LA County Sheriff Jim McDonnell, and we were talking about the barriers to training first responders in the very many things in which they need training. Training requires taking people out of the field, off the streets. And that created the idea to create a series of videos instead. The goal being that they be short enough and practical and pragmatic so that people did not have to be taken off the streets. They could be seen during roll call or in between calls. At that time, we reached out to the Amundsen Foundation as a nonprofit. We were able to secure funding. I enlisted the support of an Emmy Award-winning film documentary producer, Matthew Murray, and we partnered with Long Beach Police, LAPD, and the Sheriff's Department to produce a series of training videos on mental health, very similar to these we're presenting today. We thought at that time, if we got a handful of police departments to see them, it would be a success. Within 2 weeks of launch, over 200 police departments accessed our free videos. Now, today, today, well over 400 departments as far away as Perth, Australia, are using our videos. That, to me, spoke to a real thirst in the community for knowledge and skills around mental health. So at that point, I reached out to our friends in Long Beach Fire to see if there was interest to do something similar for them, and they referred me to RTG, the Regional Training Group, which is an amazing collaboration of all 29 LA County fire departments who come together to train in unison. And with their help and, again, funding from Amundsen, we were able to produce these training videos for fire departments. And once again, because of the funding from Amundsen, we're able to put them for free on our website for any fire department anywhere who wants to make use of them. You know, mental health is something that is clearly very important to me. It's how I've dedicated my career. But we all know the urgency of this. 1 in 4 adults, 1 in 4 children in the United States right now suffer from a diagnosable mental illness. But we know only about 25% of those people actually get treatment. 70% increase in suicide rates amongst children in the last decade. A 70%. And none of us have been blind to the increase of the homeless mentally ill on our streets. And this was all pre-COVID. So the impact of the isolation and the withdrawal and the anxiety of COVID, we have to believe and understand that that has only exacerbated our mental health crisis. It's more important than ever that we are all trained in understanding what this is when we see it and how to effectively interact with our mentally ill in crisis. It's especially important for our first responders. And I can't tell you how grateful I am to this group of fire departments who so eagerly embraced partnering with us on this. I'm really proud of the videos we produced together. I was promised a ride in a fire truck and I didn't get one. I'm still holding out hope, but I'm really very, very proud of the videos, and I hope that they go a long way to creating more trauma-informed responses in the field. I particularly want to thank Long Beach Fire. We could not have done this without them. The Guidance Center is headquartered in Long Beach, so they're our partner department. And without the Heart team and Darren Curry, we would not have been able to pull this off. So a special thank you to them.
Thank you, Patricia. I'll now turn it over to Chief Espino, Fire Chief of the City of Long Beach.
Good morning. Thank you for your participation with us today on the kickoff for the Mental Health Awareness video training series. I'd also like to thank the Guidance Center, LA Area Fire Chiefs Association, LA Area Regional Training Group, and the Amundsen Foundation for partnering with the Long Beach Fire Department to put on these videos. First response mental health training addresses the evolving needs of pre-hospital care and addresses situations that are often overlooked in preparing firefighters as they deal with acute medical events on the streets of our cities. In Long Beach, we see the value of providing this type of training to our employees. It is essential to provide them with the tools necessary to navigate the impacts of personal trauma experienced on the job, as well as navigate the impacts of personal trauma in private life, and finding ways to successfully mitigate situations that can quickly escalate when dealing with patients experiencing a mental health crisis. First responders are increasingly being called upon to serve not only as paramedics and firefighters, but to step into the role as a crisis manager. These roles include, in some cases, a social worker and therapist. First response mental health training provides the tools to keep firefighters, paramedics, and the community safe. In the fire service, there is an expectation that firefighters will always be ready to respond at a moment's notice. Regardless of the situation, firefighters are taught to push forward through adversity and focus on the mission. However, that approach needs to be adjusted based on the situation. We're dealing with increasing incidents involving patients that present with various symptoms associated with a mental health crisis. It is up to us to learn about these potential scenarios and look to professionals for guidance and direction as we develop tools that will assist us in de-escalation techniques. First response mental health training is formatted in a way that allows easy access for in-station training. This reduces the need for out-of-service training and maximizes access for personnel to attain training that can be worked around the schedule of the station and keeps the resources in service to respond to emergencies. The fire service must change the way we do business. We must evolve to the ever-changing climate of our communities and provide services that meet unmet needs that have been overlooked for far too long. The first response mental health training is another tool that will assist us in meeting these demands and doing it in a way that addresses the root of the problem and not simply the symptoms. Change is a process. Tradition sometimes gets in the way of that. The mental health of those wearing the badge is something we need to evaluate. We must stay ever vigilant of each other and look after each other. We must eliminate the stigma surrounding mental health in the fire service. Efforts must be made to connect our personnel with resources that are there to help, such as the first response mental health training resource. We must create an environment where it is acceptable and even encouraged to ask for help. We must take a proactive approach to addressing mental health issues with our personnel. As leaders of our organizations, we need to take the mental health of our personnel seriously. Unaddressed mental health related issues can cause career-ending and unfortunately, in some cases, life-changing events. Providing resources to our personnel and our community has been something that the Long Beach Fire Department has made a priority. We continue to evolve and find innovative ways to focus on those we serve, as well as addressing the needs of those that answer the call to serve. The fire department is in the business of taking care of people, regardless of who they are, where they live, their race, their gender, or their socioeconomic status. Various ways that the Long Beach Fire Department addresses this is based upon the following results-based solutions. The Long Beach Fire Department has a robust critical incident stress management program where we send specially trained fire personnel to support other fire personnel who have responded to or experienced a traumatic incident or event. The peer support system has been in place with our department for over 25 years and continues to be the primary source for supporting our own when the need arises. A department-wide wellness program is also available to personnel to provide additional supportive services that include conditioning and strength training, wellness lectures that focus on good nutrition, and mental health lectures with an emphasis placed on developing and maintaining a whole-body approach to wellness. Additional efforts to support mental health awareness includes a department-wide training class. This 8-hour course for our firefighters teaches a 5-step action plan encompassing the skills, resources, and knowledge to help an individual in crisis connect with appropriate professional, peer, and self-help care. The class, titled Mental Health First Aid for Fire and EMS, guides firefighters through the unique risk factors and warning signs of mental health problems. In addition, firefighters learn about the importance of early intervention and how first responders can help someone in crisis or experiencing a mental health challenge. This class was done in partnership with Mental Health First Aid USA, a program managed, operated, and disseminated by the National Council for Behavioral Health. Mental Health First Aid is included on the Substance Abuse and Mental Health Services Administration's National Registry of Evidence-Based Programs and Practices. In addition, in November 2016, the Long Beach Fire Department also introduced the Homeless Education and Response Team, or HART. Their mission statement was to reduce the number of fire department response to individuals in experiencing homelessness through the rapid response to 911 calls for service, collaboration with continuum of care partners, and educating the fire service and community members about local resources and the issues surrounding homelessness. This included addressing issues related to managing individuals experiencing a mental health crisis. Upon its inception, one of the goals of the Long Beach Fire Department Heart Unit was to provide education to firefighters and paramedics about the complex and diverse needs of the unsheltered homeless population and how to connect homeless individuals to appropriate services. Based on research developed and published under the County of Los Angeles Homelessness Initiative, Phase 1 of Strategy E4, which outlines creating a coordinated system through first responder training. This training will emphasize strategies for dealing with situations that arise among the large populations of individuals experiencing homelessness and who have mental health problems. In keeping with this strategy to enhance first responder training, the incorporation of the first response mental health training into our department training curriculum will provide immediate value to our agency and to our region. We are in the business of saving lives. It is imperative that we continue to provide the best resources possible to our personnel as they go out into our communities and respond to those experiencing a crisis. Having a resource that was created by professionals in support of first responders is essential, not only for our patients, but also our firefighters. Thank you.
Thank you, Chief Espino. Now I'll turn it over to Chief Garcia, Fire Chief for the City of Burbank and President of the Los Angeles Fire Chiefs Association.
Thank you, and good morning. I'm pleased and privileged to be able to be participating in this event this morning. This is something that's been long overdue and really a nice tool that we're going to be able to utilize as a fire department. Firefighters and paramedics in Los Angeles region are accustomed to facing a wide range of emergencies and are the most highly trained first responders in the world. But thanks to this new tool, the First Response Mental Health Training video series, our region's firefighters and paramedics will be even better equipped to deal with the certain solutions that they face daily. And those are the scenarios that involve mental illness. Firefighters and paramedics currently receive some training on various nuances and manifestations of mental health disorders, but this training will bring to them a new level. The First Response Mental Health Training video series delivers essential orientation to first responders to better identify signs of mental illness in the field and the know-how to de-escalate these encounters and safely and effectively. According to the National Institute of Mental Health, nearly 1 in 5 U.S. adults lives with mental illness. This equates to over 5 million Americans. This is a significant number. Mental illness, known to be a major contributor to homelessness, which is known to be a significant and growing problem in the Los Angeles area. So this timing couldn't be better. Why else is this training needed and so highly valued at this particular time? We are all acquainted with the numerous stressors related to the COVID pandemic, and sadly, this pandemic has been a tremendous stressor in the lives of millions. Barriers to mental health treatment rose greatly during the pandemic and increased restrictions to healthcare facilities. Continuous media coverage of the pandemic for many intensified anxiety and fear for individuals with pre-existing mental health illness. The period during and following the pandemic has been known over the years to be associated with an increase in various mental health illness impacts such as depression and even suicide. This training is very timely. This video series teaches practical skills to help first responders with a broad range of concerns. The topics covered include de-escalation and assessment of the mentally ill, interfacing with homeless and mentally ill, active suicide, understanding autism, what to do when it's a child, limitations of psychiatric holds, empathetic notification, and self-care. The First Response Mental Health Training video series stresses the importance of emergency medical personnel relying on their tactical training, while also providing understanding of people with mental illness are going through and the tactics to safely de-escalate a mental health crisis situation. So as an organization, the Los Angeles Fire Chiefs Association embraces this training and looks forward to its use by thousands of first responders in the Los Angeles region. On behalf of our region's fire chiefs, I would like to thank the Guidance Center for an excellent training program and encourage all first responders in this region and beyond to avail themselves to this excellent training. It will also allow a group to be more compassionate and more effective when dealing with mental health illness. Thank you.